just washed my hands. Hi, I'm Brittany. I'll be your nurse today. I'm going to do a head-to-toe assessment on you.
Okay.
Can you tell me your name and date of birth?
Shamina, 3/8/1990.
Okay. Can you tell me where we're at today?
We are at the clinic.
Okay, what day is it?
It's Saturday.
Good deal. So she is oriented ×4, alert, facial expressions are appropriate, her mood is consistent and appropriate, her speech is clear, not slurred, and she has an appropriate attention span. I'm going to tell you 4 words to test your memory, and then I'll ask you to repeat the 4 words later on.
Okay.
They're cat, dog, tree, and house.
Okay.
Okay. Her vitals are heart rate is 75. Blood pressure was 123/78. Her respirations are 16, and her pulse ox is 98%. Temperature is 97.9. On a scale of 0 to 10, can you tell me your pain right now?
0.
Okay, good deal. Your skin is appropriate for ethnicity, clean, no lesions. Check your skin turgor. Good. Warm, dry, intact. Head is normocephalic. I'm going to touch your hair. Her scalp is clean. Her scalp is clean, no parasites. I'm going to put some gloves on and test some cranial nerves. Okay. Her face is symmetrical. Can you clench your jaw down for me? Okay. And that is her trigeminal nerve, cranial nerve 5. Can you smile? Okay, frown. And puff air in your cheeks. That is facial cranial nerve 7. Can you close your eyes for me? And I'm going to try to pull your eyelids open. Good. And also, can I see your nails? No clubbing. In less than 3 seconds. For cap refill, her eyes are clear of drainage. They are symmetrical. This is where you would check for the Snellen scale. So she would stay 20 feet back and try to read the chart from the top to the bottom as far down as she could. And then for cranial nerve 8 is oculomotor. Cranial nerve 4 is trochlear, and cranial nerve 6 is abducens. Going to check your eyes at the pen light. Can you follow the light for me without moving your head? Good. And the other side. Okay. Now look. Sorry. Now look straight ahead, and I'm just gonna look at your pupils. All right. Pupils are 3, brisk, and round. Let's see. No nystagmus. Let's see. Your ears are symmetrical. I'm gonna look in your ears. Turn your head that way for me. Clear of cerumen. Okay. So I'm going to whisper a word and you tell me what I said, okay?
Puppy.
Okay, good. This is where I would use the otoscope that we do not have to look in each of her ears. Test to look at the tympanic membrane. It should be pearly gray. Her nose is midline. I'm going to touch on your sinuses just around your eyes and your nose, okay? And you tell me if it's tender. Any tenderness? Okay. Can you hold one of your nares shut for me and breathe in? Okay, the other side. Okay. So both nares are patent. Also to test cranial nerve 1, the olfactory, she would close her eyes and I would hold up something like cinnamon or an orange coffee and she would identify the scent. I don't have any of that with me right now. So I'm going to look at your mouth. Her lips are symmetrical. They're not dry. Can you stick your tongue out for me? Okay. Her tongue is pink. Can you say ah?
Ah.
Okay, tonsils are present. Can you give me a big smile? Teeth are white and all present. Her gums were not bleeding. Healthy gingiva. Cranial nerve 9 is glossopharyngeal and 10 is vagus. Cranial nerve 7 is hypoglossal. Can you repeat the words light, tight, dynamite for me?
Light, tight, dynamite.
Perfect. I'm going to palpate your neck and check for range of motion. Can you tell me if there's any tenderness here? Okay. So I checked her lymph nodes, no tenderness. Can you look up and down for me? Perfect. Side to side. Okay, and spin your neck in a circle. Full range of motion. Okay. Can you try to resist my hand? Okay, and the other side. Perfect. Now can you push up on me? Okay. So cranial nerve 11 is spinal accessory, which is why I had her rotate her head against my hands and lift up her shoulders against gravity. Her lymph nodes, she denied any pain or tenderness, no swelling noted. And I'm going to listen to her carotid arteries. Alright, no bruits present. Can you repeat those words for me?
Cat, tree, dog house.
Yes. So that is her recall memory. Let's see. I'm going to listen to your lung sounds. Take a deep breath in. Okay. Another sound. Good deal. Okay. Move your hair over. Deep breath. And again. Okay, she is clear in all bases on both lobes. Now, we are not going to do a breast exam, but I'll tell you how you can check your breast at home. If you use your 3 fingers and raise your arm, palpate under your underarm area for any swollen or tenderness in your lymph nodes. You can also use those 3 fingers while you're laying down and go vertical, up and down on each breast or in a circular motion. Then if you put your hands on your hips and bend over, check for any unevenness in both breasts. One is larger than the other typically, so that is normal. Your areola should be darker. Make sure that the borders of it are symmetrical, and when you squeeze on your nipples that there's no discharge. Okay, and report any abnormal findings to your nurse or your doctor. All right.
Thank you.